and we will get going. Perfect. Well, good morning, good afternoon, good evening, wherever you're joining us from this week. My name is Dr. Eric Kennedy, and I'm an assistant professor of disaster and emergency management at York University in Toronto, Canada. It's my pleasure to have you all here and part of the conversation in this ongoing COVID-19 survey methods working group. Over the past year, we have been collecting and curating a conversation of people doing interesting methodological work related to surveys in the context of COVID-19. And today I'm very excited to have Dr. Cristiano Vezzoni from the University of Milan, who will be able to talk to us about a project that he's been doing in the Italian context, tracking public attitudes and experiences throughout the pandemic, and doing some innovative and interesting work with longitudinal design to try to track this over time. As always, with this group, we hope that you're willing to ask your questions of Cristiano as the talk goes on. If you're joining us on Zoom, of course, you can use the chat function within this call. If you're joining us live on YouTube, you can use the chat over there as well, or send me questions by email. Without any further ado, I will pass this off to Cristiano. We'll have his presentation for the first 20 minutes or so here, and then I'm sure we'll have a fruitful and interesting conversation after that. So, Dr. Vezzoni, thanks so much for joining us today. We're glad to have you here, and we're excited to hear about your presentation and project.
Yeah, thanks, Eric. Thank you very much for having me here today. I am very glad to present our work that we are carrying out in the Italian context. As you said, I'm Cristiano Vezzoni, and I am a researcher at the University of Milan in the north of Italy. And I'm a coordinator of the SPS Trend lab that is basically a hub for survey research in the Italian context. So tonight I want to present the work we have developed since the pandemic outbreak in Italy, and I will start with a few slides that will help me to present my data. So I share my screen. I hope it's going to work immediately. And
yes, we see that loading up.
Yeah, okay. And you should have like a full screen now.
Yes, that's perfect. We've got that.
Okay, so that is like the context. Our research is called Response COVID-19. And is a shortening for a response of the Italian public opinion to the COVID-19 emergency starting in 2020. Okay, so first I would like to start with some background concerning the Italian situation, because I assume not everyone is familiar with that. Italy was like the first Western country where the coronavirus had a serious outbreak. It was in February of 2020, and quickly the situation worsened. And on March the 9th of 2020, a national lockdown was declared. And basically for 2 months, we were unable to move away from our home, very much like other countries. There was a first lifting in May, at the beginning of May, and even further in mid-June. And that brought to a opening in the situation. It seems that the pandemic was over, but then in the fall, it took over again, and we had the peak of the crisis around October, November, then a decrease, and again recently in March the conditions started again to worsen, and we had a third wave with a further lockdown that is now getting to be eased. We started on April 26th, so it's very recent, the removal of the heaviest restriction. One thing I also want to show you of the Italian context is that we are a peninsula in the Mediterranean. We have a very different geographical territory, and also like the pandemic just hit in a different way. And the first wave was mainly in the northern Italy, and then for the second and third wave was more generalized. But you see from this graph, with the total cases and total death every 100 inhabitants, the impact was different in the country. So our starting point, let's say, for the research was March the 9th. We just found ourselves in a national lockdown. We couldn't go to the university anymore, and we couldn't give lessons anymore at the university and also in normal schools, and also not going to work regularly. So the question for my research group, what to do? And then we realized that COVID-19, among other things, was also a stress test for survey research. So how to address the problem of COVID-19? We had some references and some indications from the WHO requirements that were issued very early at the beginning of the pandemic to carry out behavioral studies on COVID-19. And the requirements were just like indicating that the studies should be evidence-based, they can be rapidly applied, regularly applied, simple and flexible to adjust to the changing situation, and low cost and effective in terms of cost. So those were the indication. But of course, like to implement this indication, that you have to consider what are the constraints you have. And the situation can be very different whether you have or not research infrastructure. Our case was one of non-existence of a previous research infrastructure, for example, a panel or a study that was carried out in a regular way, like in other countries. And here I just give an example of a situation with an infrastructure that is like the Mannheim Corona study, where you can find like a description in this article. So our constraints basically were budget. We had a low budget for that. We were in a hurry, and we didn't have a research infrastructure. So where were our answers? At the starting point, we opted for web interviewing because it was suited for the scope, also because we couldn't make a face-to-face interview, and it was cheap. But that meant that we didn't have an option for probabilistic sample, and we had to find a collaboration with a commercial research company on an opt-in online community sample. That it was our answer, this response COVID-19 that I've already described in the name before. It is like mainly a study on public opinion. And given that we were with several constraints, the idea was to also exploit the situation in which we were as an opportunity to implement something innovative. There is a description of our study that came out last spring in 2020 on survey research methods, and you can find more details. But now I'm going to give you some indication of what we decided to do and what was our strategy. Basically, the first thing that we brought in our given our constraints was to exploit the nature of the phenomenon that we were studying, that is a pandemic. And we took inspiration from electoral studies, basically rolling, and we decided to implement a rolling cross-section design that I'm going to describe. But before describing it, I want to say that the origins of the rolling cross-section designs are actually in Canada, and one of the basic researchers that developed that is Richard Johnston at the University of British Columbia, that worked at the Canadian Election Study and the National Annenberg Election Survey in the United States. And I just gave a few references to the work that presents this kind of design. So what is basically a rolling cross-section design? What are the characteristics? Basically, the idea is that you are going to use a tool that is used. It was used in the past basically to study electoral campaigns. And we arrived to this decision to apply this design because we saw the analogy of electoral campaigns, unpredictable and rapidly changing, with a pandemic context. And how it is drawn, running cross-section design, basically you have a large sample that you start with, and you slice this sample in many small subsamples that you allocate to consecutive days. So you have like a large sample and randomly sliced in subgroups allocated to consecutive days. Each subject is then associated with one of these subsamples. That means is going to receive an invitation to answer to the interviews in a particular day. But the idea of rolling comes from the fact that the respondent is not bound to answer in that specific day, but it can answer whenever it gets to answer from the day they receive the invitation to the coming day, when it happens is just like open to the respondents. Basically, the respondent has the possibility to answer the interviews as long as the fieldwork is open. From here, it comes this idea of those rolling samples over time. And when you do this, there is an important property that is just like achieved, that the day of completion of the questionnaire become a causal variable. What are, in fact, the properties of a rolling cross-section design? You have high granularity. That means you can monitor a phenomenon in timely details, day by day, basically. If you apply a random selection for subsamples, you have also, although the general sample could be biased, the bias are just like distributed randomly. Therefore, they are constant over time, and they should not affect the study of trends. And the day of, and moreover, the most important thing that especially in the pandemic time, the day of the interview becomes a link, a key to merge survey data to an evolving context. So just to see what is the relation between your data and the context and the events that happen during the pandemic. And moreover, and finally, you have the possibility to adapt your questionnaire to new events in case they arise. So this is basically the idea of our sample, and with the idea of introducing this possibility to have a granular monitor of the unfolding of the events and the effect on the public opinion. Our sample, although was subject to constraints because we were working with a commercial research institute, and we had to go for an opt-in panel. That is a limitation that was drawn considering quotas for gender, age, and residential area in Italy. We started with a large sample that was 33,000 people. We had approximately 160 interviews each day in average, and we reached a total of more than 15,000 interviews for a response rate of 45%. As far as the questionnaire is concerned, given this possibility to be flexible, we had a part that was a core questionnaire that was administered all over the period we covered. And we had rotating modules on different topics. The question in the core questionnaire were the usual that you can imagine in a COVID survey. So I'm not going to spend time on that. Here you have a first picture that can explain what happens in terms of data collection. So here you have for each week the number of interviews that we collected going from April the 6th to July the 6th. And you see what was the questionnaire that was administered. We had the core questionnaire that ran from the beginning to the end of the survey. And then we had 5 rotating modules on religion, gender inequalities, democracy, state and versus market, and European Union. So you see that each week, basically, we had 1,200 interviews approximately. And this is just like the whole sample it was drawn. And the interesting thing, interesting property of the rolling cross-section design is that if you leave free the respondents to answer whenever they like after they have received the invitation, then at a certain point you have a stabilization of the composition of your samples day by day, depending on the days the person were invited. And here I gave like a representation of this. This is just like a graph of the composition of our daily samples over the first 10 weeks of our research. And the composition is defined depending on the delay the respondent have answered. So you see that basically 65 to 70% of the respondents do respond the day they receive the invitation. And then you have parts of the respondents that come from previous day, but basically more than 90% of your respondents will be from the precise day or maximum 1 week later. Only a few just answer far later than this. So this is just like to see that once we have, after the first week where we have like a takeover effect that we have to adjust to, then we have a stabilization and the samples are basically equivalent over the period. And then we said, what is the scope of our research? Basically, monitoring public opinion during the unfolding of the dynamic event, that is the pandemic. We were focused mainly over on the trends over time. So we were mostly interested in dynamic dimensions that do change over time, possibly in connection with the unfolding of the pandemic. And we had this strong point given by the rolling cross-section design that we could integrate our survey data with the context. Here I have a small example of that is you can find in the publication I have indicated. We had a question that was one of the questions we liked the most because it showed a lot of dynamic. The question was, in your opinion, what should the government do now? Decrease, maintain, or increase restrictions? This is a very interesting question because the answer of the person is not a baseline or just like a basic belief of a person, but it adjusts very much to the situation and to the measure that the government is implementing. And you see, for example, the solid line here in black that represent decreasing restriction. And you see from the beginning of our data collection, the attitudes of our respondents did change dramatically with a request for easing the restriction until a certain point. Here you see on the 26th where we had a first change in the lockdown, and later on the 3rd and 4th of May we had that, and you see the curve just changing, the bending toward more people asking for increasing restriction. The interesting thing is that we could complete this trend until the end of our data collection, and you see that over the time of the first wave, there was first a peak of respondents that wanted an ease under the extreme lockdown we were in until the 3rd of May. And later on, people started to realize that possibly it could have been a problem to ease too much, and they started to ask for more restriction. That is the yellow line that you see in this graph. That is the complete graph for the whole period. So this is the presentation of our study. And the important thing that you have to have is, like, at the end of a study, you come about with the lessons you have learned, what you have made wrong, or what was the real problem on that. I'm going quickly because I think I will have question on this, but basically the first big issue on our design was the sample. We had like a non-probabilistic sample, and we know from literature that basically you have a problem of underrepresentation when you apply, when you use this kind of sample. So I'm ready to discuss further this point. But we learned a very important lesson when you work with a commercial institution. We neglected this in the past, but we learned that it's extremely important, especially in a dynamic design as a rolling cross section, that you have to force the commercial institution, the commercial research institute, to supply you the list of the complete list of names that are in the sample before starting the field work. Because in this way you can control daily what is happening, and you force also the research institute not to change in any way the design you have decided at the beginning. That was a very important lesson that we are applying nowadays in our new research. Then I have 4 small other points that I want to take. When you are just in a situation that is very uncertain, like a pandemic, then you have to decide the question you have in your questionnaire, and there is always a trade-off between theory-driven choices of question and emergent topics. Our experience is that you have to force yourself to find questions that they can travel over time, and they are not too bound to what is happening, because otherwise this question can become quickly old. It is important, although most of the studies were nationally based, to find bridges with other countries, because that gives much more power to your research, and to make an effort in terms of accessibility of your data. And for us, that was a problem, because we didn't have an infrastructure and we were not able to release our data immediately. So this is just like a minus point in our endeavor, and we would like to improve that with the release of our data. And finally, in the points of relevance is like that we've learned an important lesson that when you are in an emergency, you are in a hurry and you have a lot of work to do, teamwork is essential. And also we decided to go for team authorship because that it was a reward and an incentive to all the team to work loyally to the project. We also learned a very final important lesson, that is like you do not have to underestimate a pandemic, because we started with the first wave, and at the end of July we thought it was over, and we were starting to prepare to write a book on what was the experience in the first in the pandemic, and the impact on the public opinion. And when we started to write the list of the table of contents and to write the first chapters, then the pandemic took over again, and we were just like again in even a worse situation than before. And that brought us to an important decision. We left aside our plan to exploit our data, and we made an effort to start to collect new data. That brought to the collection of new funding, and we were able to have a cross-sectional survey at Christmas time. That was again a lockdown situation. And with the funding of a private institution, we were able in March to start with a new data collection that this time will be for the third wave. It will have again a rolling cross-section design, but with a panel component that is suggested in literature to be a very powerful design. So we will go to interview again the same people that we have interviewed in the first wave of our study, at least partly. We have 9,000 cases of that expected in our 11,000 cases, and we will have a refreshed sample. An important improvement that we have in this time is that we had a more efficient selection of the respondents from the panel design, and the refreshed sample is adjusting a bit on the biases we had in the original sample. And as I told, we have learned our lesson, so we requested the list ex ante to the Research Institute for the management of the design, more precise management of the design. This is like the final outcome of the question we have seen before. And I show this question because we have already learned what is about. So in your opinion, what should the government do now? Decrease, maintain, or increase restriction? And you see that there is still a lot of dynamics in this, in the answer of this question. If we focus on the last part in the second wave of our field work of 2019 that started on March 18, you see that people were getting kind of tired of the lockdown that was again implemented in our country. And so there was an increasing, very highly increasing amount of people that were asking for a decrease of the restrictions. But on the 26th of April, as I mentioned, that there was an ease, and you see immediately a response from the public that is coming back to accept what is the following situation, and also with a regain of power of the people asking for an increase in measures. That was my last slide for tonight. I also give an overview of the publication that we have produced until now. We have a couple of presentations of our research that I've already mentioned, and just like to give you an idea of the broad range of topics that we are touching and the diversity of our group. We have publication on the relation between COVID and religiosity, gender and social inequalities. We have now forthcoming an article on the beliefs on the origins of the coronavirus, and therefore connected with conspiracy theories. And we are working also actively on the impact of coronavirus on the beliefs on democracy, and therefore on democratic theory. So this is like what we have been producing until now. We hope to produce more and also to have the possibility to share this work with you. And I also give some references to the rolling cross-section design if you are interested in this. So thank you very much, and I hope you enjoy the presentation.
Cristiano, thanks so much for that. I really appreciate your willingness to share and the detailed insights that you've given us from this. Maybe if you're all right, what we could do is stop your screen share for a moment, and we'll get back to your face so that we can have the conversation here. As always, I'd love to be able to work in questions from the group, so feel free to put those into the chat, whether you're joining us on Zoom or if you're joining on YouTube, you can ask them in the chat there as well. Okay, there's a ton I would like to ask about because this is really interesting. And as you showed towards the end, that this design gives us some interesting opportunities to analyze some dynamically changing factors in the landscape to see how it is that policy is being received and changing public opinion. But before we get to some of those broader questions, I do want to hear just a little bit more about the sampling piece that you talked about and hinted at. So one curiosity that I had was to learn a little bit more about how often, if at all, participants were welcome to return and complete another survey. Did they only have one shot here? Were they re-invited? Are they only being re-invited now in the 2021 round? How did that work?
So basically, like we started from this opt-in large community that research institute has in Italy, this SWG. We have been working extensively with this research institute, so we know well how they are working, and we trust each other. So that was an easy point to be quick on starting our survey. Basically, our constraints on the sampling was given the quota design that we had. People could enter in the sample. The sample was designed at the beginning before starting to field the research, so they could enter just once. They were invited one time over the period. They were allocated to 1 day invitation, and they had a chance to answer one time. So we didn't have like repeated interviews of the same people. So one person had an option either to answer or not answer. So it was just like an opportunity, and there was not repetition in the first wave that we had. This changed in the second wave that we are carrying out now, because there we were explicit on wanting to have a panel design. So now a large part of our sample is built starting from the original sample of the first wave, and we are going to re-interview at the end. Our plan is to re-interview 9,000 people. So we will be able also to study individual change. But in one way, you have one shot and you can answer only one time the question.
Excellent. So you hinted here that, or were quite explicit about this need to get the full roster of your sample. I'm wondering if you can tell us a bit more about the context, perhaps behind that, and some of the challenges that you ran into or other researchers might run into if you don't do that. What are you trying to fix or solve with that approach?
Yeah. So there is one thing that we realized. We've been working already 15 years with these companies, and so we know them well. But in this occasion, that was a great opportunity because we got to understand in depth what are the problems. So one thing is like research institutes never reason in terms of the original sample, but they always reason in terms of the numerosity of the final sample. So when you go to a research institute, what they want to know is how many cases do you want, okay? And not what is your starting sample. So given that, if you have a complex design as a research rolling cross section, what happens is that also the research institute, even if you ask to draw the sample at the beginning, they have constraints given by, for example, the quotas. So for example, you start with a number of old people in your sample, and then at a certain point, you realize that these old people are answering more than what you expected. So what is the tendency of the research institute is to correct for that, okay? So because they want to exploit as much as possible their community. So they do not want to waste areas of their community unexpectedly. And that was a little bit the situation in the first wave, because there was one thing that happened, and you have been discussing that in the last meeting you had. Suddenly it happened that there were more people answering the invitation. We were not expecting that. We were expecting some response rate between 30 and 35%, and suddenly we had 45%, and also categories that we didn't expect. So there was a push from the research institute to make a correction because we were getting too many interviews, for example, and they didn't plan that. And so that it was hard to an art bargaining with them. And at the end of the day, we have now to act with waiting to correct some of the things that happened during the design. But then, having learned that lesson, now for the new wave, we said we want to have the list of the contacts, and that list is not going to be touched. We appeal to the goddess of randomness. We prefer some random variation rather than manipulate during the design.
Yeah, and as you mentioned, that was a really interesting theme from the conversation last week about how the composition of these panels themselves changed over the course of the pandemic in terms of who was answering. And so the idea of locking it in up front is interesting. I guess the flip side of that is an issue we've run into in some of our work experimenting with these commercial providers, which is panel churn, or basically people falling off of these panels and not participating down the road. I'm wondering, is that something that you encountered at all when trying to do this follow-up a long time on? Is that something you ran into throughout the process? Was panel churn and attrition in that way?
Well, I must be honest on that. That is like that is an opt-in panel, and the response that you have is slightly better than what you could expect. So we've been, for example, we've been running for elections, for the Italian election study, a panel that ran over now, we started 2013 and we had the last collection in 2020. So like for 7 years, and we were able to have very decent response rate with not a dramatic attrition. The thing is like, it was pretty decent, and we didn't have the usual problem you have when you have more purposive, strict design, like, for example, offline sampling, because there you really have to run after your interviewees. Here, the interviewees were pretty disciplined. That is possibly like let's say a bias of those respondents that we know. But the thing was like, we are not getting too many problems to have them to answer again, although 1 year passed through.
Thanks for that. We've got some great questions coming in the chat here, and I want to come to Andrea and Daniela around the content and design of the survey in a minute. But Bryn, I'm wondering if I could go to you now. I know you've got a couple of questions that you were interested in asking. Oh, and I just need to get you unmuted here.
Unmute
Perfect.
myself. Thank you, Cristiano. That was extremely interesting. I have basically 4 questions. They're not particularly oriented towards your particular project, but are much more theoretical in nature. I hope you don't mind. So the first one is, I think in a survey like this that one is very, very concerned, and you raised the issue of sampling questions. And so the flip side of that for this particular type of survey is the whole issue of selection bias. So I am wondering what, if anything, you try to do about selection bias. The second thing is that you raised a distinction, which I thought was very interesting, between like a theory-driven approach that you as researchers might have, and say, I would contrast that with what evidence do we get from epidemiologists, and how do you begin to put those 2 types of evidence together in terms of a research project? The third thing is just really I'm a surprised question that you were able to obtain from a commercial survey operation the names of respondents. I'm really very surprised about that, given, you know, commercial privacy type things. And the final thing is that Richard Johnston, who in fact at UBC, as you mentioned, a Canadian political scientist of major renown. In fact, I was just talking to him this morning. He has a lot of very interesting suggestions, more than anything else, about the way in which a panel at the end of a research project can give you some really strong insights into the pluses and minuses, if you like, of the rolling cross-section design.
Mm-hmm.
So the question of the where do you
Yeah.
think that you're going to use the panel is the final question. I'm sorry I'm going on with my questions, but
Yeah.
it's so fascinating what you had to say.
That's great. Thanks so much, Bryn. And maybe we can start with the first question there about selection bias.
Yeah. So there is like one answer that you can give when you have like a strict methodologist that is able to say you can't do that. The thing is, like, there is not much to do with selection bias when you are just working with an opt-in panel of a commercial institute. But I do not think so. I think like it can give you like important insights. And there is one thing that we are doing. We are including a number of questions that comes from higher quality surveys. For example, European Social Survey, European Value Studies, that they have probabilistic samples face-to-face. And we are triangulating with that result. So we don't have only an indication that, for example, we have too few old people or too few young people. That is trivial, okay? But we can just check on the old people which kind of answer they give to question. We know what are the marginals you have. And so you can have far more insight on the kind of quality that your sample have. So this is one thing that we applied in a systematic way.
That's very interesting. Yeah.
Yeah. The other thing is that as dramatic as it is, the bias you have in those samples, we also have to be realistic on the fact that we cannot call them samples of the population, but is of the general population, but is of course samples or just like a selection of individuals from that part of the population that has an access on the internet. Okay, so that is also one thing you have to keep in mind and to control for.
But sorry, Cristiano, but that is the effect of the stimulus.
Yeah,
I mean, in this case, you have the stimulus is COVID-19. It affects everybody, whereas an election, for example, will affect, quotes, everybody, but it will not affect everybody, and we know that.
Yeah. So, but that is just like to say that it's there is a further bias that is unsolvable. So if you have an online panel, even if it's probabilistic, then you have that limitation, and this is just like basically what you have to confront for. But there is a property of the rolling cross section that I mentioned very quickly in my presentation, that those biases, if you do a good job in randomizing the invitations of the individuals you can reach, those biases, they are equivalent all over the period you are like running your sample. So it is difficult, it is not possible to make estimation of quantities or for example of ratios, but you have a better view, or it is more reliable, the study of change over time, because maybe you have wrong the level, but you have right the trend. So that is just like the idea.
No, I agree. I agree with that. Yeah.
So I will close. I will stop here. Although we could make many seminars on this problem. Yeah. Eric, do you want? Should I continue to answer this question or?
Yeah, I mean, let's see if a couple of brief answers here, because I do want to make sure to get to Danielle and Andrew's questions as well.
Answer to the third and fourth question. We didn't get the names. I just mentioned also that in the presentation, but I was too quick. We never saw any name, so that is not possible. But we had the assurance that the selected cases were there by means of codes. So we simply saw like codes that are not connectable with names. So we do not want, and in Europe it's not possible to transmit names to anyone except you have a contract and a supervision of the privacy authority for that.
Yeah.
And finally, concerning like your suggestion to use well our opportunity for the panel to also understand more of our terms, I just follow up on what you say. You were lucky to talk with Richard today. I would say that we are keeping Richard as our point of reference when we have a challenging question. Then we are. I'm just writing an email to Richard, and is absolutely generous in giving you advice and indication. So, for example, one thing that we solved together with Richard was the decision on how to allocate cases in the panel, rather randomly over the period that you have your panel rolling cross section, or with a fixed distance with the first interview. And then there with Richard, we came quickly, or Richard just like said to us, there is no doubt that random attribution, it's far better. So for example, that is an example of the cooperation that is ongoing. With Richard.
I agree with, he is a wonderful, wonderful person. So, wonderful.
Say hi to him in case you see him.
Well, yeah.
Bryn, thanks for those great questions. And I'm sorry we don't have more time to dive into them, but Andrea and Daniela have asked some questions about the sort of substance of the survey and the user experience that I think raise some intriguing issues here. So Andrea was asking about the user experience for participants completing the survey. So to what degree were participants able to skip questions that they perhaps were uncomfortable with? Were these forced choice? Were they soft require? And then maybe if you can tell us a bit more about the experience as well as in terms of time to completion and the design like that.
Yeah. We always, well, let's say, I would say that our general rule is to supply way out of the question. So I don't know answer, or I do not want to answer a refusal option. So as I said, maybe this is a little biased by the kind of respondent you have. It is not massive, the use of that kind of answer. And concerning the second part, given that we have been working for a long time with them, we also had a few studies carried out. We have publication that I can share on the use of screener question. So we had like tricky questions where basically the idea was to understand whether the people were either reading or not the questions. And so we came to an optimal length, let's say, we got to a conclusion that I would say when there is a part of the respondents that they are just going through too quickly. But here we can control for response set and for just like too quick times of answering, and it does not happen in a substantial way. But of course, then you have respondents that are using heuristics to answer your question. So they do not read the question, but they read the answer categories, for example. And we came to a conclusion that basically, if you have to make a balance, if you have to decide between bad respondents of bad question, we came to the conclusion that most of the time where you have low quality answer, the responsibility is most of the time on the formulation of the question is given by bad formulation, but not even bad formulation. It's like our principle is that in an online panel like this with many questions in one questionnaire, questions should be one line, no more than that. You cannot require like a respondent to go through reading 3 lines questions, vignette, or this kind of thing. Otherwise, you have to do something far more specific, less question and more motivation to the respondents. So we try to keep questions short, to give like the possibility to choose like answer categories that they are partly autonomous, so that you can refer also only to the answer categories to have an idea of what you are saying. And we also have controls for the quality of the respondents, whether they are lazy respondents or active respondents.
Those are very real challenges. And I know, at least from my personal experience with these surveys, it's also been difficult to do very thorough pilot testing with some of these, particularly in rapidly evolving contexts, and to make sure that they'll be read the same way across a large and diverse country, and across the multiple languages of the survey. And very challenging. I mean, that brings us to the question of the questions themselves. You hinted in your lessons at the end on the importance of choosing questions that travel over time, which I really like that phrase. I'm wondering if you can give us an example of a question that you're really proud of in terms of how timeless it was, and a place where you wish you had known something earlier or thought of a question earlier in terms of things you know now that you wish you had been asking about at the beginning.
I think like the question I showed you, like the distribution of the question, what the government should do now, as long as we are talking about the pandemic context, of course, because we hope in 2 years' time to be far away from this crisis. But we were very happy with that question because respondents were able to give an answer. It was not a problematic question in terms of giving an answer. And we were able to see that the same formulation of that question just applied to any possible situation, because the object of the question, that is like what the government is doing now, it is always valid. So it could be a strict lockdown, or it could be easing, but we know, and that we know because we have a rolling cross-section design. So we can feel the content of that question, knowing when that question was asked. And so that shows really the strength of the design that we have. And so for that question, we say it was very rewarding to analyze that question because it's very dynamic. It makes a lot of sense. You see very immediate response from the public. So it makes very much sense in the terms that we are doing that. Of course, we have been studying in the past, before the pandemic, the vaccines. And in the first wave, I would say we should be more keen on putting more question on vaccines. So like we were a little not well covered over that topic. And one advice that I could give concerning this question that travel over time is exactly what I mentioned before with the quality of the question I discussed. What should the government do now? Decrease, increase, or leave the measures that he has? The worst kind of question you can do are questions concerning a policy of the government in a specific moment, because the governments are very unstable. We can take Great Britain, for example. Every second week at the beginning of the pandemic, they were changing their policies. And that happened to us in this second wave because we had a question concerning the national vaccination plan. And at the beginning, the criterion was to give priority to frail people. And we started with that question, if it was right or not. And after 3 weeks, the government decided to go for a strictly aging criterion, starting from the oldest, getting to the youngest, and we were forced to change the question. Yeah.
I lived those kinds of changes firsthand, and so I think that lesson is incredibly important. Okay, the discussion here about these kinds of specific questions, I think, brings us nicely to Daniela's question. She says that she's interested in hearing a bit more about the results that you obtained. Was there anything that really surprised you? For example, were there significant gender differences on particular issues, or other kinds of differences that really struck you as surprising or interesting?
Let's say we have like a paper, or a colleague of us, Giulia Dottisani, had a paper in collaboration with the Constance University in Germany, and they filled the same module in our survey, in their survey, and they studied the impact on households where there were couples. And of course, there you can see something that is intuitively relevant, that pandemic was more affecting women. And the interesting thing that we found in that paper is the perspective that you have from the men and the women in the couple are pretty different, because like the men are just like overestimating the contribution they give being at home, compared to the women that they already indicates that they are doing the most part of the homework, and at the same time they also see that increased in during the pandemic. So it is interesting to see how the different perspective is not complementary, because if you have a man and a woman, then if the man increase the amount of work that he's doing, then there should be like a decrease on the other side. So a more equal sharing of the task at home, and that is not the case in the perception of couples. So it's very different. Things that we have been seeing. We have a group in our team that is intensively working on the impact of COVID on religiosity, and we have been able to prove one of the things that we are studying for a long time, that religion can be a comfort source, but that is available only to people that have some kind of memories of religion. Although they are secularized, maybe they are not going to church, but the importance of using religiosity to have comfort in crisis time becomes relevant only if you have some kind of socialization in the past, although you are not religious at the moment, that gives you the tools to use religiosity as a comfort source. And that was another interesting point that we have. Finally, we have one point that we are studying now, and is very problematic, but because it's such an important variable, that is like how close you were to the disease, to the pandemic, in terms of casualties or disease in your family, on in your circle. So we have an interesting module on that with a few questions, but the problem is that we didn't develop that in a way to understand precisely what people refer to when they said, I had a person that died within the family. So if we were talking about the household, the close circle of relatives, or the large circle of relatives, of course, because dying is a very emerging experience. So even if you have a cousin that is very far away, so even as rough as it is, the variable as we measure, it looks like it has a big impact on the way people see the pandemic and the impact that people had from the pandemic. But we are still working to try to have a better measurement of the closeness of the disease to the single person in terms of social circles.
I think that's very, very important, Cristiano, because there are enormous, even obviously within Europe, cultural differences with respect to family, with respect to, you know, attitudes to government, and so on and so on, that are going to just sort of, they're not going to necessarily obfuscate the differences on a societal type or socio-psychological level, but they are going to give some noise to the type of conclusions we might wish to make. I mean, what we're talking about, let's face it, we're talking about people. That's you, me, everyone we know, and the rest of the world facing something which is quite catastrophic. This is the issue, right?
Yeah, because we gave so much importance to that question, because our reading of the pandemic was that the coronavirus crisis was something that you can compare to a war or to a major event like the fall of the Berlin Wall, that had a time effect that just touched everyone. And that variable on the closeness of the disease, it is showing us that almost everyone did experience directly the pandemic within the family. And the thing that we are discussing that with demographers, because our estimates from our survey of the proportion of people that really experience that directly, it sounds a little too high compared to the numbers that the epidemiologist and the demographer gives, computing like the number of relatives you have and so on and so forth on demographic models. And this is the point of Bryn, that is like how in a crisis situation you define your relevant connection, your family connection. So where your family, where you reach with your connection with relatives in a pandemic situation, where it is the meaningful connection.
I agree.
I hate to cut this off because it's such an important and fascinating topic, but unfortunately we're at the end of our time and I need to wrap up. I do need to ask, a couple of folks asked in the chat about the name of the authors on the German collaboration paper that you were just mentioning, Cristiano.
Yeah. Is the name, you mean like the one on female or?
Yes, I believe so, yeah.
Yeah. So if it is for the female, here you have, it is, here we have Kulic and Sani. 2020 is on European societies.
Perfect, thank you.
It's just out. And if you want to have indication of the Mannheim panel on the Mannheim Corona study, this is just like Blom Cornesen.
Great, thank you. This has been a fantastic talk, and it's been so helpful and so insightful because in many ways, I don't know about others, but I, as a researcher, really turned to the Italian experience in those opening weeks of March as we were conceptualizing our project and developing it. And so it's so fascinating to hear about the work that you were doing as all of us were just in the genesis phase of our own research on the topic. So thank you for sharing. Folks, we have a week off this coming Tuesday, but the next Tuesday after that, we will be back with a very different kind of survey. We will have a speaker from the Swedish Health Services in Seattle, Washington, which is not the Swedish government, but rather a hospital network in Washington state, who will discuss surveys that they've been doing with endoscopy units. With medical professionals to better understand how these medical professionals have been experiencing the crisis and how caseloads and experiences have changed throughout the duration. And so I think that will be a very fascinating, if very different kind of group to survey and to talk about. So again, that is not next week, but in 2 weeks' time.
Okay,
with
great.
that,
thank you, Eric. Thank you, Cristiano.
With that, thank you so much.
Have a great week.
One thing I want to say just to close is like, we are preparing the data set. So we hope in a couple of months to release the data set for all the scientific community in the world. So that's, I hope you are interested to analyze those data. Okay.
Thank you,
Excellent.
Cristiano. Thank you.
Thanks so much for a great talk. We will see you in 2 weeks. Take care.
Yeah, bye.
And Cristiano, I'll just say thank you again now that I'm off of the